Prayer.
Almighty God, who in your wisdom and goodness has appointed the offices of leaders and parliament
Prayer.
for the welfare of society, good of all human lives upon it, and the just governments of its people, we beseech you to look with your abundant favor upon us, God, your servants, who in your wisdom you have necessitated the offices of leaders and parliament for the welfare of society, of all human lives upon it, and the just governments of its people, we beseech you to look with your abundant favor upon us, God, your servants, who in your wisdom you have necessitated the offices of leaders and parliament for the welfare of society, of all human lives upon it, and the just governments of its people, we beseech you to look with your abundant favor upon us, God, your servants, who in your wisdom you have necessitated the offices of leaders in the parliament for the welfare of society, of all human lives upon it, and the just governments of its people, we beseech you to look with your abundant favor upon us, God, your servants, who in your wisdom you have necessitated the offices of leaders in the parliament of the
We have to
society,
suspend for
of all
so that
human lives
people
upon
don't
it,
issues.
and the just governments of its people, we beseech you to look with your abundant favor upon us, God, your servants, who in your wisdom you have necessitated the offices of leaders in the parliament of the
We have to
society,
suspend for
of all
so that
human lives
people
upon
don't
it,
issues.
Mic testing. Mic testing. Mic testing. Is there sound?
Yes.
You can hear me.
Yeah, we can hear you.
Mic testing. Honorable members. Is it working? Now it's working. Testing. Now it's working, yeah? Is there sound?
Yes.
Almighty God, who in your wisdom and goodness has appointed the offices of leaders. Lakini bado iko chini. Bado iko chini. Is it working? IT, now it's working. Ongeza voice. Now it's working, yeah? Is there sound? Almighty God, who in your wisdom and goodness has appointed the offices of leaders. Makwei, ongeza voice. Is it okay now? Chini. Bado iko chini. IT, iko sawa? Okay. Imapio. Makwei, ongeza voice. He got a shock that we are back. Hello. Iko sawa? Okay. He got a shock that we are back. Hello. That we are back. Hello. Hello, hello, hello. Hello, hello, hello. Hello, hello, hello. Honorable members. Iko sawa? Honorable members. Hello, hello, hello. Victor, can you hear me? Jophitus. I think iko chini sana. It's too low. Makwei, is it okay? Jophitus. It's too. Hello, 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 hello. Is it okay? Ni ile niko na shida peke yake. It's too. Hello, 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 hello. Is it okay? Ni ile niko na shida peke yake. Hello. 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 Is it okay? Ni ile niko na shida peke yake.
Hello. Okay.
Hello. 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 I think it's better this one. This is better. So it's this one.
Mic testing. Yes. No, we are good. We are good. Product, we are good now.
Hello. Okay.
Hello. 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 Hello.
Let me tell you.
Come connect. Hello. Mic testing. Mic testing.
Testing. Now we are good. Product, we are good now.
Hello. Hello. Testing. Testing. Come connect. Hello. Mic testing. Mic testing.
Yeah, okay.
It's only this mic. Hello, hello. Mic test 1 2 1 2. Simple sound. 1 2 1 2. Mic test 1 2 1 2. Hello, hello. Mic test 1 2 1 2.
These are the foods of the day.
1 2 1 2. Mic test 1 2 1 2.
Oh. Why don't you come there? Oh. You come to Grameria. Oh, sure.
Prayer.
Almighty God, who in your wisdom and goodness has appointed the offices of leaders in parliament for the welfare of society, good of all human lives upon it, and the just government of its people.
Prayer.
We beseech you to look with your abundant favor upon us, your servants, whom you have entrusted with the performance of such important trust in this community. All human lives, let your blessings descend upon us, your assembly of its people, and grant that we may treat and consider all matters that shall come under our attention and deliberation, whom you have entrusted in so just and faithful a manner as to promote your honor and glory, and to advance peace, prosperity, and welfare of this region, and of those whose interests have committed to us. Amen. And delegation has taught us in the faith of the manners that we try to support your honor and your each man is like welfare is and of those.
Item 1 on the order paper, communication from the chair.
It seems that we have some issues with the IT. We could maybe fix them quickly.
Item 1 on the order paper, communication from the chair.
It seems that we have some issues with the IT. But I was told that we can proceed.
Item 1 on the order paper.
So we proceed. I will make my communication, of course. Honorable members, I have to welcome you all to this house. So we proceed. This house is your home, Arusha, and it has been a while, as you know. The last time we met here, it was it last year? Communication, of course, in honorable members, October. Welcome you all. Almost 1 year. So this house is your home. Thank you, God. We could be here today, while, as you know, and we hope that the last time all others plenaries will take place here. Was it last year? So, honorable members, October. Almost you have the program that have been approved. It has been circulated to you. Last time all others and I appeal committees to ensure that they finalize all business before them and report to plenary as per the program. I know it's not easy. We have some clerks who have left us. I know how difficult it is, but please do your best. Work hard and get ready the program. I know to report to the plenary. We have some honorable members in our gallery. How difficult it is, but we have guests. Work hard. One, we have a delegation from the County Assembly of Nyeri in Kenya, which is led by Mr. Francis Kabui Kariuki, Deputy Clerk in charge of administration. One, there we have one Francis Kabui Kariuki, scholastic led by Mr. Francis Jiri, Josiah Matenge Wahinya, Joseph Kimiti Muya, Lassi Bitutu, Matthew Kibui Maina, Peter Maina Karuru, Dennis Omangi, Estash Kingori Murage, Charity Mumbi Muriuki, Brenda Wanjiru Wanjugu, Lassi Wambui Mwangi, Priska Jematia, Joshua Mwangi Ndiritu, Caroline Wanjiru Muriti, Charles Wanshira Mwangi, Lydia Warukira Karuri, and Agnes Wambui Mwangi. Please stand so that I can recognize you. Thank you. You are welcome. This is your headquarters, Arusha. We also have Agnes staff from our colleague office, Honorable Suleiman Shabar. He brought his staff. We have to recognize them. We have Yuba Bishar Omar and Bakar Swabir. please stand to be recognized. Thank you. And we have staff, we have to recognize them. A delegation from the Parliament of Uganda. And we have Kamoma Raymond, Kojo Eden, Luigo Charles, Esingu John Bosco, Boso Jam Wangudi, Kirunda Henry, Sempidra Peter, Katumba Godfrey, Timbungibwa Sarah, Akol Patrick, Kirungi John, and Kamara Patrick. Please stand to be recognized. You are welcome. Thank you. Now we proceed with the next. Akol Patrick, Kirungi John, and Kamara Patrick.
Okay, we proceed to item 3 on all the paper, laying of papers.
You are welcome. Honorable Chair of the Council of Ministers, to lay the papers. Presented by. Okay.
Laying of papers. Right, Honorable Speaker
Of the Council of
and
Ministers.
honorable members of the House, in accordance with provisions of Article 134, subsection 3 of the Treaty for the Establishment of the East African Community, I beg to lay on the table the following audited financial statements of the East African Community organs, institutions, and projects for the financial year ended 30th June 2024. For the avoidance of doubt, the following financial statements are the statements. 1, institutions and projects. The EAC organs, the three of them, which include East African Community Secretariat, East African Court of Justice, and East African Legislative Assembly. That's one type of statement. The statement. 1. B, the EAC organs, the EAC institutions, the 8 of them. Inter-University Council for East Africa, which is in Kampala, Republic of Uganda. Lake Victoria Basin Commission in Kisumu, Republic of Kenya. Civil Aviation Safety and Security Oversight Agency in Entebbe, which is in Republic of Uganda, West Africa. Lake Victoria Fisheries Organization in Jinja, Republic of Uganda. Victoria Basin Commission. East African Competition Authority in Arusha, which is the United Republic of Tanzania. East African Science and Technology Commission in Kigali, Republic of Rwanda. East African Health Research Commission in the Bujumbura, Republic of Burundi. East African Swahili Commission in Zanzibar, United Republic of Tanzania. C, projects requiring separate audit opinions as provided for the financial agreement. That's 1. The East African Community Peace Facility, United Republic of Tanzania. C, 2, payment settlement system integration project for the financial ES3 EAC status development and harmonization regional project. AFDB support for East African capacity building. Then 5 is Eastern Regional Digital Integration Project. And D, the donor funded projects that did not require a separate audit opinion and are consolidated in the financial statements of the EAC Secretariat. The names are quite long. that I read in that list. GIZ support that did not require a separate audit opinion. AFDB support to the road sector. Statements of the EAC. Support to EAC to combat COVID-19. The names are quite long. EAC EU response to regional security threats. GIZ support. EAC and EU core program. FDB support the road sector. ILO support to combat COVID-19. African peace support architecture. EAC EU support from government of China. EAC regional network for reference laboratories. Comprehensive support for the EAC integration. Peace support architecture. Support from national road authorities for road infrastructure. Bill and Melinda Gates Foundation support. Reference laboratories. Lastly, integrated health program. Mr. Speaker, sir, each of the organs, institutions, and projects has got a management letter, which forms an integral part of the audit report. Mr. Speaker, sir, I beg to lay. Lastly, integrated health program. Even if they look well, I hope that is late. You can help me. They can help you, Doctor. An integral part of the audit report. Thank you. Mr. Speaker, sir, I beg to lay. Lastly, integrated health program. Even if they are.
Thank you, Honorable Minister. Now we proceed.
You can help me.
I can help you, Doctor.
Thank you, Mr. Speaker. Sir, I beg.
What?
Even if they are.
Thank you, Honorable Minister. So committee on account, which is one of the committees we have, I refer these to that committee. Then we continue.
Item 3, motion for resolution of the Assembly urging the EAC Council of Ministers and partner states to fast track the attainment of universal health coverage by way of motion.
This motion was brought by Honorable Jason Kennedy. The Honorable Fatuma Ndangiza, you can move your motion.
Mr. Speaker, sir, I beg to lay a motion for resolution of the Assembly urging the Council and partner states to fast track the attainment of universal health coverage moved under Articles 49(2)D, 59(1), and 118 of the Treaty and Rule 26 of the Rules of Procedure of the Assembly. I beg to lay.
Do you have seconders? You have Honorable Odongo, Clement, Kanini Kiga, Francine, and others. You can proceed.
Mr. Speaker, sir, I wish to move the motion for the resolution of the Assembly urging the Council and partner states to fast track the attainment of universal health coverage. Moved under Articles 49(2)D, 59(1), and 118 of the treaty and Rule 26 of the Rules of Procedure of the Assembly. Whereas under Article 118 of the treaty, partner states undertook to cooperate in health by promoting the management of health delivery systems and better planning mechanisms to enhance efficiency of healthcare services within the partner states, harmonize national health policies and regulations, and by cooperating in the development of specialized health training, health research, reproductive health, pharmaceutical products, and preventive medicine. And whereas universal health coverage means that all people have access to a full range of quality health services they need when and where they need them without financial hardship, and covers the full continuum of essential health services from health promotion to prevention, treatment, rehabilitation, and palliative care across the life course. Recalling the global commitment under Target 3.8 of the United Nations Sustainable Development Goals to achieve universal health coverage by 2030, appreciating the efforts of the community towards the attainment of universal health coverage, which is expressed in the various instruments adopted by the Council, such as the EAC Vision 2050, which prioritizes strengthening collaboration among health sectors and health-related institutions in the region, strengthening and harmonizing health and health-related policies, strategies, and plans, and harmonizing health and health-related legislation and other initiatives, such as the EAC Open Health Initiative, which aims at harmonizing the health systems of the partner states in order to promote universal health coverage, and provides an ideal opportunity for policymakers to create broader dialogues about the role of health systems in fostering better democratic governance. Grateful to the Council for establishing the Health Research Commission as a specialized agency of the community to spearhead health research efforts of the community and coordinate efforts that guide provision of safe, quality, affordable, and effective healthcare services in the region, including the establishment of relevant research programs, development of capacity for health improvement of health research, development of capacity for health, improvement of health research environment, and creation of effective knowledge management platforms. Recognizing the efforts of partner states in establishment of universal health coverage schemes in Kenya, Tanzania, and Rwanda, which has the highest enrollment in health insurance in sub-Saharan Africa, acknowledging the commitment of partner states during the African Union meeting in April 2001 to allocate at least 15% of their national budgets to universal health coverage in order to improve health sector, concerned that despite the multiple policy instruments and measures adopted by partner states, the regional universal health coverage is low. The budgetary allocation for the health sector in all partner states is below the commitment of 15% of the national budget. Further concerned that achieving universal health coverage in the community still faces several challenges, including funding and resource allocation. Many EAC countries struggle with limited financial resources for healthcare, which affects the availability and quality of services. We still have infrastructure gaps. There is often inadequate healthcare infrastructure, particularly in rural areas, leading to unequal access to health services. Workforce shortages, the limited number of trained healthcare professionals can hinder the delivery of essential health services. Health system fragmentation, disparities in health policies and systems across EAC partner states can complicate efforts to implement universal health coverage effectively. Disease burden, high prevalence of communicable and non-communicable diseases strain health systems and resources. Regulatory challenges, inconsistent regulatory regulations and policies can impede the integration of services necessary for universal health coverage. Convinced that addressing these challenges requires coordinated efforts among member states, increased investment in health systems, and a focus on sustainable practice to improve overall health outcomes. Now, therefore, be it resolved by the Assembly as follows, that in accordance with Article 49(2) of the treaty, the Assembly urges the Council and partner states to fast-track the attainment of universal health coverage, to enhance the efficiency of healthcare services within the partner states, increase national budgetary allocations to the health sector to meet the commitment of at least 15% of the national budget, the harmonization of national health policies and regulations, and promote exchange on health issues in order to achieve quality health within the community. I beg to move.
You can move it. Have you justified it?
Thank you, Right Honorable Speaker. I'll speak a few words because I have a seconder, Honorable KK. But I'll just say, Right Honorable Speaker, that as a community, we are committed to universal health coverage. The treaty is explicit on health being a basic right to the citizens of East African Community. Article 118 is very clear, but then we've also put in place the policy and other institutional arrangements in our community, including programs, institutions like the Health Research Commission. But we should also be mindful that as East African member states, we also committed in 2015 when we were adopting UN Sustainable Development Goals at the UN to ensure that by 2030, we have attained the UN Sustainable Development Goals, and universal health coverage is goal 3 of the UN Sustainable Goals, in particular 3.8. And therefore, when you look at the time that is left, it's only 5 years. We need to do whatever it takes to ensure that we are able to attain that target. Let me also remind that universal health coverage, as is also clear in the motion, is about access to the needed health services, including prevention, promotion, treatment, rehabilitation, and palliation of sufficient quality to be effective, while also ensuring that the use of services does not expose the user financial hardships. So the key words here is access to health services of all citizens, irrespective of their status, where they live, their pockets, leaving no one behind. And the issue of financial resources shouldn't be a hardship. We shouldn't allow our people to utilize their hard-earned resources that could have been used for economic ventures, for agriculture, for business. And that's why today, as we speak, there is a strong link between lack of access to universal health coverage and rising poverty. According to World Health Organizations, globally every year, 100 million people are pushed into poverty due to catastrophic out-of-pocket expenditure on health. And when it comes to Africa, 30% of households in Africa have to borrow or sell their assets to be able to have access to health care. We still have challenges of maternal mortality rates, child who die at the birth or under 5 years. But we also have a challenge of non-communicable diseases, which is on the rise in our region, diabetes, cancer, and very few people have access to sophisticated Medicare, and we end up losing many people in our region. So really the purpose of this motion is a call to action for the council to expedite the various efforts. We know that there is a sectoral council on health. In 2016, the ministers of health and finance met, and one of the issues discussed was how can the community accelerate the attainment of universal health coverage. But in that meeting, it was noted that many countries were off track, and as a community, we need to do a lot to ensure that even the 15% Abuja declaration, where every partner state has to inject money in the budget of health, has to be increased. I think it's only Uganda and Rwanda who have gone beyond that threshold, but specifically in the area of HIV management and control. And again, when you make analysis, some of these resources come from external actors. But we are also aware that of recent, there were many cuts from some of the major powers that have been supporting Africa, and this has also affected health. So we need really, as a community, to mobilize domestic resources and prioritize health, because health is wealth. You cannot talk about a prosperous, united, secure community when your people cannot have access to quality health care, when they cannot have access to medicine. So as I move towards conclusion, I wanted to say that there is no one size fits all. Every country has unique circumstances, and therefore you cannot say that every country has to follow this model. And I want also to commend our partner states that have integrated universal health coverage in their visions, whether it is United Republic of Tanzania, they have a clear strategy, they have an act, Universal Health Coverage Act 2023, and also agreed to unify various insurance schemes. But of course, in all our cases, the biggest challenge has been implementation of our policies, of our strategies, and the various legal instruments that we adopt. The Republic of Kenya is also doing its best. I think when we listen even to our leaders, our heads of state, they are all committed to universal health coverage. Kenya in 2018 undertook a pilot scheme for universal health coverage in 4 districts, and it was commendable. And right now is trying to rolling out. When it comes to Burundi, Burundi has also showed commitment. They have also come up with the formula of achieving 90%, they call it 90-90, and Uganda also is also committed. They have embraced the Common African Position on Post-2015 Development Agenda on Union Sustainable Development Goals, as well as Abuja Declaration. Through its health development sector, it emphasized the need to accelerate movement towards universal health coverage. Rwanda is also committed. In fact, it has the highest enrollment in health insurance scheme in sub-Saharan Africa. We have a community health insurance scheme in French, it's called Mutuelle de Santé. And now if you combine it with the one from the government that is supporting public servants, it comes to around 90%. But of course, we want to go together as a region so that by 2030, even earlier, as a region, we are able to do a lot. The Republic of South Sudan is also committed to increasing her national health budget for universal health coverage. Unfortunately, I was not able to get some statistics on DRC, but I'm sure they also have been doing some good work in Somalia. So all in all, honorable members, this is a clear motion. Universal health coverage should be a basic right. It is about inclusive and sustainable growth. And as a community, we have to ensure, and here I'm calling the council really, we are not asking too much from you. We have to ensure that by 2030, we are able to achieve universal health coverage. But even before 2030, we need to clean our houses because it's very comprehensive. It's not only access to health insurance, it's also about quality healthcare services, health infrastructure. It's about having the right people working in our hospitals. It's about decentralizing our health services to the people. Then if we are successful in this, and I know where there is a will, there is a way, but we also need to work collectively as East Africans, harmonize our policies, health policies, reach even a day when an East African can have an insurance scheme from Kenya and use it in Tanzania and use it in Burundi. I think that's where we should go. When you talk about One Health, that's where we should be moving towards. So with those remarks, I want to thank you once again and look forward to your support.
Thank you, Honorable Ndangiza, for moving this important motion. I now proceed as the motion on the floor is that this assembly do resolve to urge the East African Council of Ministers and Partner States to fast track the attainment of universal health coverage. Debate is open and we start by Kanini Kiga, who seconded your motion.
Thank you, Right Honorable Speaker, for giving me this opportunity to second this very critical motion. I also want to thank the mover of the motion. You have done justice to this motion. Honorable Speaker, what is universal healthcare? It is a system where everyone in a country or a region has access to essential health services without suffering financial hardships. What are the key features of this UHC? One is coverage for all. It means that anybody, any person, regardless of his financial status, can go to a hospital, get treated, and go home. Either paying a nominal fee or without paying anything. Meeting a doctor, making sure that in that facility, there are health officers, there are doctors, there are nurses, there are surgeons, you know, that you can go and go home treated from any part of the country. And then there is the facilitation, where basically the governments, in most countries, the government is the one that gives the bulk of the money, but also through the social health insurances. And you have seen it in many countries. Which countries in the world have attained the UHC? You have United Kingdom, they have a very good health system, that is NHC. Then you have Canada, you have Sweden, you have Japan, Australia. None very close to here in Africa. But let's come back to our continent. And I would just want to give a few examples because the mover of the motion did very good justice by giving statistics. I will start with Rwanda. Rwanda, in our region, is considered as one of the best performing East Africa countries regarding UHC. Over 90% of Rwandans are enrolled in some form of insurance through the community-based health insurance. 90%, which is very good. And I think that they need an applause on that because 90% coverage is a huge success. The scheme has relatively low premiums per family member and some fee at point of service. That is co-payment, whereby the government gives, and then of course the patient will pay a little fee, which is actually subsidized. The health outcomes have improved significantly. Life expectancy, infant and maternal mortalities have been greatly improved. Let's go to Kenya, where I come from. Kenya has also tried. And in the previous government where I was part of it, it was part of, UHC was part of the Big Four. And the current government has now improved on the Big Four, that the UHC, which was National Hospital Insurance Fund, and now it's SHIF. Depending on who you ask, whether it's successful or not, it all depends on the political alignment. But there is a lot of work that needs to be done on that system. But by and large, it's a system that if it is improved, it will be able to have a better coverage of the country. Tanzania. Thank you so much, Tanzania. You have already done the legislation. But in terms of the implementation, there still is not 100% implemented. And I think that is also where we come in, that we are doing legislation, but the aspect of implementing what we have legislated becomes a challenge. So Tanzania, majority of them are still not covered by insurance. It's about, I think 30%. Those are the statistics that I have. So there is still about 70% that needs to be worked on. And I think it's work in progress. Uganda. Uganda, in terms of the insurance, from the statistics that I got, I didn't get a particular legislation, but there were attempts to legislate in parliament. But of course, sometimes the interest of the private sector, the employers, I see that. So there is work to be done. As the mover had alluded to earlier on, the other statistics are not very well given. And those are some of the challenges. And I think that is the reason we need to urge. And I'm hoping that the Council of Ministers will take this very, very seriously to make sure that when they go back home, they are able to implement it. Honorable Speaker, what are the challenges that are facing our countries? It is one is budgetary allocation. The national governments are giving a little bit lower than what is internationally recognized. Most countries are not giving sufficient funding to the UHC. The second one is that most of our people are not formally employed. They're in the informal sector. So when they're in the informal sector, it becomes very difficult for them to access the insurance. So we need to register and make sure that even those who are not in formal employment are able to register in the health facility, in the insurance. Honorable Speaker, as I conclude, on the legislation, and I had alluded to, many countries have also passed these UHC laws, but unfortunately, the laws are not being implemented. So the parliaments are doing their part, but also the government or the executive is not implementing. Honorable Speaker, With those very few words, Honorable Speaker, I want to say that this is work in progress. I believe that at the end of the day, we will be able to pass this motion, and the Council of Ministers in their respective countries will be able to take it over and make sure that we provide health facilities, UHC to all our citizens, because it's a right to all of them. Our health is our wealth. I thank you, Honorable Speaker, and I beg to second this motion. Thank you, Honorable Speaker.
Thank you, Honorable Kanikiga. Now we get the names of those who want to contribute. Clerks, can you give me the list of the names? There are 11. There are 10. Did you capture them? Thank you. Do you have them all? I think you can see it. They have captured all of you. Thank you. So for you, they're all from the one side and the two on the other side. Let's go starting with Honorable Dr. Siranda and then we'll have Honorable Kayonga, then Honorable Sankok, 3, 4, Honorable Odongo, 5, Honorable Mary, 6, Honorable Shaba, 7, Honorable Clement, 8, Honorable Makame, 9, Honorable Matthias, 10, Honorable Katramba, and 11, Honorable Gladness, and we will stop there. So Honorable Siranda, you have the floor.
Right Honorable Speaker, from the onset, I want to appreciate you for giving me the opportunity to make my contribution, unheartedly contribution. I am taking care of 2 of my children that are sick, very, very sick. I want to appreciate colleagues that have prayed with me, supported me. So a question on health insurance is a very important aspect. And when I speak as a father, but also as an East African, that is a village boy, I know that this is a timely motion, Right Honorable Speaker. The benefits for East African community, countries belonging to the East African community, first is to promote the question of our economy, the economic growth, to increase on our trade. When we eliminate barriers to facilitate trade and movement of goods and services for our people, Right Honorable Speaker, the question on the common market aspect, Right Honorable Speaker, it envisages that we want to look at an East African who is healthy, that has capacity to make a contribution to the economy, for you to benefit from the removal of all the trade barriers, to benefit from the free movement of people. Right Honorable Speaker, we will be lying ourselves if we do not look at the question of how healthy our people are. that when a person wakes up in the morning in any part of our countries, our partner states, they are sure that they will have the basic or the health insurance without even thinking through on when you travel to India. Right, Honorable Speaker, a lot of our countries are spending a lot of money. The budget on flying abroad, outside East Africa, to seek for treatment, right, Honorable Speaker, is unimaginable. That's one of the reasons is because we have not taken care to ensure that a lot of our countries, people have access to quality and healthy insurance. That is very essential for us to have it. The benefit is that I'll be in position to have kind of a template in terms of what I get in any of these partner states. I will be in position to find it in Uganda if I'm there. I don't need to fly to Nairobi all the time. I am telling you, I'm going to Nairobi, I'm going to India. What am I looking for in India? I went to India, Right Honorable Speaker, with my daughter. The doctor I found there was a Ugandan doctor. Right Honorable Speaker, why did I find a Ugandan doctor? The doctor told me, wait for a doctor, he's coming from Africa. And my mind was maybe South Africa, maybe which kind of Africa. And getting there, I waited for 4 days. The doctor I missed seeing in Kampala is the same doctor I found in the hospital where I went. The reason was that there was no facility. The knowledge is there in Africa, but there is no facilities that can support these medical personnel. The health insurance, universal health insurance, will deal with the question of making sure in terms of having the facilities where our trained men and women within Africa will have that. Right Honorable Speaker, this motion is in line with the East African, the East African Health Research, the East African Research Institution. Right Honorable Speaker, it will be charged, first of all, with an initiative of making sure that they oversee the question on where we have a uniformity where we want to have, so that a common man who wants benefit from a common market, a common man, a woman who wants benefit from the removal of the trade barriers, Right Honorable Speaker, they will be healthy without spending a lot of money. And so I want to heartily support this motion and urge the Council of Ministers to fast track this initiative because it is timely. We cannot have a community where we are talking about a lot of things, yet health is a key ingredient of what we want to benefit for us to grow this community. I beg to second the motion, Right Honorable Speaker.
Thank you, Honorable Sianda. Now, Honorable Kayonga. Try to be brief.
Thank you, Mr. Speaker, for giving me the opportunity to support the motion by Honorable Ambassador Fatuma for a resolution of the Assembly urging the Council and partner states to fast-track attainment of universal health coverage. It is a timely motion and indeed a practical way to ensure people-centered development and an improvement in the quality of life of East Africans. Mr. Speaker, sir, universal health coverage, as has been said, would mean equitable access to healthcare to all East Africans, regardless of their socioeconomic status. Let us envision all East Africans having access to health services they need, when and where they need them, and without financial hardship. This is the East Africa we want. Aside from equitable access, which others have talked about, there are numerous other benefits to universal health coverage. They were mentioned in the motion, including improved health outcomes. And we know that with improved health outcomes, you'd have a healthier population. And with a healthier population is a more productive population, which would ultimately contribute to economic growth in East Africa. Mr. Speaker, sir, I would like to limit my contribution to improved health outcomes using the example of the Republic of Rwanda, where I am very familiar, having been the permanent secretary in the Ministry of Health from 2006 to 2008, when we were building the universal healthcare system, after successfully piloting the community-based health insurance scheme that Honorable Ambassador talked about, that is popularly known as Mituelle de Sante, which was piloted just at the dawn of the 21st century. Since Rwanda introduced the community-based health insurance scheme, it has experienced remarkable growth from a coverage of 7% of the population in 1999 to 91% in 2024 or 2025, I can say, which is a significant milestone in Rwanda's efforts to ensure universal health coverage by 2030. Universal health care. Now, Rwanda aims to achieve 100% universal health coverage by 2030, ensuring that all citizens have access to essential health services without facing financial hardship. So as a result of universal health coverage, Rwanda has achieved impressive health outcomes, including, as Honorable KK mentioned, in maternal and child health, improvements in maternal and child health, reductions in disease incidence, and increased life expectancy. As already mentioned in the motion, the universal health coverage includes a full range of services, from health promotion to prevention to treatment and care. With increased access to prenatal care, skilled birth attendants, and emergency obstetric services, Rwanda has dramatically reduced its maternal mortality rates. It's now about 210 deaths per 100,000 live births, much higher than the global average. In fact, mortality rate has also improved significantly, estimated to about 30 deaths per 1,000 live births because of increased vaccination and health access, of course, and nutrition. Under 5 mortality rates stand at 40 deaths, about 40 deaths per 1,000 live births, arising from improvements in maternal health, child health care services, and nutrition. And then life expectancy is now approximately 68 to 70 years, which is a significant increase from the post-genocide years and reflects improvements in healthcare access. I could go on, but let me stop there. The point is that universal health coverage would be a big boost to the welfare of East Africans. And they've mentioned the challenges. These challenges that are in the motion, these are the challenges that were there when we started, and they are still there. But when you set the target, you find, Honorable Ambassador Fatuma mentioned that that target which we've given ourselves of 15% of the national health budget, it automatically leads you to doing it, to increasing to finding a way to deal with the challenges. You've set the target, increased health coverage, and then the budget goes with it. And it's surprisingly, for me, I believe that if Rwanda can do it, others can do it even better. Just go to Rwanda and study that model. It utilizes, that contribution. I don't know whether Honorable Keke talks about it, but it's private insurances, government insurances, all contribute to that insurance scheme, and it does work. And people are able to pay, by the way. If 85% of the population can pay a little bit of that premium, the rest, government, donors pay for the very, very poor. It is very, very possible. I submit, let me rest my case and I submit, and I urge members, please support this motion.
Thank you.
Thank you, Mr. Speaker.
Thank you, Honorable Caroline. Now, Honorable Sanko.
Thank you very much, Honorable Speaker, for giving me this opportunity to really support this very good, noble, timely motion by Honorable Ambassador, Her Excellency Ndagiza. And it is really timely because there will be no development without a healthy population. No prosperity without a healthy population. There will be no democracy without a healthy population because sick citizens will not vote. Our citizens, Honorable Speaker, are one disease away from poverty. Some of them, they get a disease, they sell land, they sell vehicles, they exhaust all their resources simply because of one disease, if it is not universally covered. Honorable Speaker, even members of parliament, not only of Eala, but of respective countries, they are suffering from donor fatigue. Every day, they are attending fundraisings for ailing constituents, Honorable Speaker. Every weekend, there are several fund drives. So, Honorable Speaker, nobody is left because of lack of universal health coverage. Honorable Speaker, but I want to urge Honorable Dangiza that we should include universal health coverage, but also with accessibility. Persons with disabilities sometimes suffer from stigma by going to those health facilities. You find a pregnant lady on a wheelchair. When they approach a lady doctor, who is also probably even pregnant, will tell her, which beast have made you pregnant? As if they cannot also be mothers. Honorable Speaker, they shy away from health facilities, sometimes because of stigma. Sometimes they are not accessible at all. They have to be carried on stairs to third floor to fourth floor. And maybe I may be a person with disability, but I have some pride left in me. When you carry me like a sack of potatoes, I also feel a bit demeaned. So, Honorable Speaker, even accessibility is very paramount. Honorable Speaker, again, there are silent killers that we don't cover in our insurance and in universal coverage. I think the Parliamentary Committee on General Purpose was taken through a silent killer called hemophilia or bleeding disorder, where a person seems normal until that time, because they cannot clot while bleeding, they get a scratch, they bleed to death. Some of them bleed to death through circumcision, some bleed to death through childbirth, because they are not covered medically by this universal health care. Lastly, Honorable Speaker, because I don't want to take a lot of time, the General Purpose Committee was met with the World Hemophilia Federation, led by Honorable James Kago and Dr. Kibet Shikuku, and they were taken through, and I think we really do understand this silent killer. Honorable Speaker, there will also be no proper health coverage if we don't also talk of training of personnel in the health sector. If we commercialize education, especially when you commercialize training of medics, training of doctors, Honorable Speaker, nobody will invest and don't ask for return investment. When they invest a lot in the training, they will increase their consultation fee. They will seek greener pastures elsewhere because they need return on their investment. So, Honorable Speaker, with those very many remarks, I urge the whole House to really support this very important motion. Thank you, Honorable Speaker. I support.
Thank you, Honorable Sample, for being brief. Honorable Odongo.
Thank you, Right Honorable Speaker, for giving me the opportunity to debate the motion. From the outset, I want to say I'm supporting the motion. Right Honorable Speaker, allow me also take this opportunity on behalf of Uganda chapter to extend our invitation to all of you members of Eala to celebrate with us the Independence Day. The Ugandan consulate in Arusha has already extended the invitations to the different chapters through the chapter chairpersons. So we are looking forward to hosting you this weekend. Karibuni sana. Right Honorable Speaker, I want to thank the mover of this motion for this very, very timely motion, but also I'm concerned that who is listening, and we are an echo chamber, because I see only one member of the council here. I know that they will escalate these recommendations to council, but also, you see, listening to our voices is very important, because you get a personal connection to the issues that we raise in the House. I understand that our council members are very busy, but the business of the assembly is equally very important. And even more that we have not been here for almost a year. So isn't it a good time to just say hello to our council members? Right Honorable Speaker, this community has blueprints on our healthcare strategies. In fact, there is a document which is called the Health Sector Investment Priority Framework, 2018-2028. It's a 10-year investment priority framework for the EAC. And under priority number 7, it talks about provision of universal health care to all East Africans. And there's a commitment in that document for each partner state to develop and provide universal health care to its citizens. By now, we should be looking at how do we, bring together through best practices in these different partner states and come out with not just a policy issue, but even legislation, so that we have a landscape that mirrors each other in all our partner states. But we are now in 2025, going to 2026. And we are having a motion asking the Council of Ministers to prioritize this issue. This is something that came up in 2018. And the policy people are not here. You see, all these things start with the policy and then it escalates into a legislation. And in the absence of our policy foot soldiers, we probably are just, we are reducing ourselves to just expressing our sentiments. Right Honorable Speaker, it is within your powers as the presiding officer of this House to bring this House into order, because these are our members and they are supposed to be subjected by the same rules that govern this House. And their presence here is very, very important, because they are the ones who translate these debates that we have here into policy actions, into legislation. Right Honorable Speaker, we have experienced in the last 1 year or two the withdrawal of financing by the usual suspects, World Health Organization, USAID, and I think that we had a very high affinity as partner states to depend so much on Western financing. And now that Western financing has been significantly reduced, it has sent shockwaves to our health sector. Now, this is an area that we don't have to compromise. As partner states, as a region, we need to rise to the occasion. And I think that this motion speaks exactly to that, that we must now try to push back on the weaponization of, aid. Because, we used to, all these big European Union and so on and so on have been using aid as a geopolitical weapon to cause influence in our partner states and in our regions. It's time now that we domesticate resource mobilization and ensure that we begin to finance the critical sectors. And one of it is the health sector. So financing of the universal healthcare is a very critical priority for our partner states. In Uganda, for example, our budget for this year, 2025-2026, for the health sector is a paltry 6.1%. It's a 6.1%. Our ambition, as per this, is 15%. This is more than double the investment in the health sector. And yet this is equally very, very critical. I know that as a country, our strategy is preventive healthcare, which means that we should, as much as possible, try to educate our populations to prevent them from going to health facilities. Because once you have preventive healthcare as the first line of defense, then going to the health facilities is your second line of defense. So while we do this, we need to have a kind of like a dual track. So we have preventive healthcare on one side, but we also need to have the sufficient facilities, including the financing, so that people can get healthcare at the lowest cost, but also it serves as an incentive to healthcare givers. By the way, by financing universal healthcare, you are actually also supporting the private sector, because then there is sufficient resources from the public that is available. And that will give an incentive to the people who have taken flight, like the ones that the Honorable Siranda is talking about, to know that their services will be easily paid for. There's a quid pro quo relationship in this, that you give me and I give you. The trouble is that we have had problems with incentives to our healthcare givers. And this is one of the areas that has made healthcare an extremely expensive venture in our partner states. So I am 100% pro this motion, but also we need to interrogate the existing blueprints, policy papers that are there in our partner states, including here in the region, and see and try to audit where are we in the implementation of these commitments. The Chair Council is here, and I'm hoping that through you, Council can really have a robust conversation about this. But for this conversation to take place, the community must first survive. Please focus on the survival of the community. Thank you so much.
Now the next, Honorable Mary.
All right, Honorable Speaker, I also want to take the opportunity to, first of all, thank you for allowing me to contribute to this motion. And secondly, Mr. Speaker, I want to congratulate the Honorable Fatuma Ndangiza for a timely motion and a very relevant motion to the citizens of East Africa. Mr. Speaker, there is no doubt, and I don't even think that anybody in this House would oppose this motion. It's timely, it's needed by East Africans, and there are many reasons to justify why East Africans deserve and need this health insurance system that some of our partner states have put in place. As we all very well know, the United Nations declared universal health as a human right. And this was some time back. Article 25 recognized healthcare as a human right. And so all governments have an obligation to provide healthcare and good healthcare to their citizens. Secondly, Mr. Speaker, I think that a health population is a productive population. You cannot be productive if you are unhealthy. And if you look at the statistics, healthy populations tend to produce more, while those who lack healthcare are absent, they are ill, their children are ill, and so on and so on. And I think the mover and the second have really put it very well. And therefore, investing in healthcare is also investing in the development of our countries, which East Africa needs, and which I'm sure our leaders are aiming at doing. Also, it promotes productivity, as it's as very well said, and also reduces inequality. Whether you are poor or rich, at least you have a right to go to a health center, provide your insurance, and get attended to. Therefore, the inequalities between the rich, the haves, the what, my child is sick, and so I don't have money to take my child to a health center for healthcare, is eradicated that way by making sure that everyone has access. And in so doing, it also provides an opportunity for that child of the poorest of the poor to live and in future to be productive and add to the income of the country and be a useful citizen. Having said that, Mr. Speaker, I also observe that different countries of East Africa have adapted different ways of providing health care to their citizens. Honorable George has talked about Uganda aiming at preventive medicine, and this for quite some time. The NRM government has been aiming at that. Examples are clear: vaccination of all the children born in the country, vaccination against any outbreak of any disease for every citizen, that not just citizens, by the way, in Uganda, even if you are not a citizen, if the child is born in Uganda, is entitled to vaccination against all diseases. Same as if there is an outbreak of a disease, could be Ebola, could be COVID-19 and so on, everyone is immediately entitled to being vaccinated, and sometimes even forced to do that. Now, I also want to mention that Uganda has been providing healthcare system in a decentralized manner. And I'm told now there is a white paper to provide universal insurance for all the citizens. But the way it has been done over time and over years was to decentralize healthcare from the lowest level, which is Health Center 1, Health Center 2, Health Center 3, and Health Center 4 at the district level, from the parish to the sub-county to the district, and eventually to the National Referral Hospital, which are not many. But every district is supposed to have a referral hospital, which serves then the centers, the health centers at the lower level. Now, citizens of Uganda or people living in Uganda are supposed to have access to those health centers. But I guess when you put everything together, you realize that there are Ugandans who can afford to go to certain hospitals beyond the government hospitals because they can afford it. And there then the insurance system works better. But I also think that when you have insurance, there is supposed to be government insurance, even in countries that are well off, Canada, Sweden, and so on. But there is also private insurance, meaning that those who can afford are going to pay for a higher premium insurance, which will give them access to any health center or any quality hospital that they can afford. While there are those who will have access to government or to who will be holding government insurance, health insurance, and so they are limited in terms of where they can go. So we need to look at these systems and see really what works well for East Africans. And I believe that there must be studies going on that compare the different systems. But the most important thing is to ensure that every citizen of East Africa has access to good healthcare system and does not have to travel all the way from where they live in order to access that health care that they need. I support the motion and I thank the mover. Thank you, Right Honorable
Thank you.
Speaker.
We now give the floor to Honorable Shaban, but please try to be brief. We still have 6 members who will contribute.
Mr. Speaker, thank you for this opportunity. And I stand to strongly support the Honorable Ambassador Fatuma's motion for universal health care. Listening to my colleagues, a lot of the things that I wanted to say have already been said. But it is very clear to all of us that every single one of us here at one time or another have had to support our people with hospital bills. And it is not in somebody's dignity to go around looking for help to settle hospital bills. So this is not only necessary, but it is also for the dignity of our people, that they should not have to beg for assistance. We've had situations of many people avoiding going to hospitals simply because they can't afford the hospital bills. And sometimes avoiding this hospital is even more expensive. And I want to give honorable members the example of polio. The cost of a polio vaccine is exactly 10 US cents. But the failure to administer this 10 cents vaccine can lead to a lifelong of disability, and the costs of taking care of people with disabilities is incredibly high, as my brother and colleague, the Honorable Sankok has pointed out. In terms of economic impact, a healthy population definitely leads to better productivity and better attendance at work. Of course, there are challenges. Those of us who are from Kenya have seen the challenges that we have in implementing the universal health care. Financial challenges, upfront costs, long waits in lines, human capacity, but challenges lead to improvements. So whether we like it or we don't, this is something that is absolutely necessary, and we should make it a priority. Therefore, without going into too much details, I stand to strongly support this motion. Thank you, Mr. Speaker.
Thank you, Honorable Shabal. Now, Clement.
Right, Honorable Speaker, honorable members, I ready to support this important motion moved by Honorable Fatuma and seconded by Honorable Kanini Kega, urging the Council of Ministers and our partner states to fast track the attainment of universal health coverage in our region. Right, Honorable Speaker, honorable members, universal health coverage, as endorsed by the United Nations Sustainable Development Goals 3.8, guarantees that all people have access to health services they need when and where they need them without suffering financial hardship. For the East African community, this is not merely a health target, it is a matter of regional stability, equity, and socio-economic transformation. Fast-tracking universal health coverage is critical for 3 main reasons. 1, equity and social justice, that is number 1. Recently, we participated in a presentation on hemophilia cases in EAC. They really need support and access to health facilities. The second reason is regional integration and cohesion. The last one is economic growth and productivity. Healthy citizens are productive citizens. Right, Honorable Speaker, honorable members, EAC has already taken commendable steps, such as developing EAC Health Sector Investment Priority 2020-2030, and through commitments under the Africa Health Strategy and the Abuja Declaration. However, progress remains uneven across partner states and in some cases slow. This motion calls on the Council and the partner states to prioritize domestic financing for health to reduce over-reliance on external donors. Honorable Odongo explained well this point. To harmonize national health insurance schemes and explore possibilities for a regional health insurance mechanism. To invest in human resources for health, including training, retention, and equitable distribution. Strengthen the primary health system care as the backbone of universal health coverage. Lastly, it is to enhance cross-border cooperation in disease surveillance, health emergencies, and medicine regulation. Like the Honorable Speaker, honorable members, the people of East African community are looking to this assembly to speak with one voice on an issue that touches every household. By fast-tracking universal health coverage, we shall not only save lives, but also build a stronger, more integrated and prosperous East African community. I therefore strongly support this motion and urge all honorable members to do the same.
Thank you, Honorable Clement. Now, Honorable Makami.
Thank you very much, Mr. Speaker, for giving me opportunity to add voice on this important motion moved by Honorable Fatuma Ndangiza. It's very timely, and it's topical, Mr. Speaker. Mr. Speaker, allow me at the outset, Mr. Speaker, to say that I'm in full support of the motion, although I'll be having an additional, I'll send my sister two additional recommendations at the end so that to sharpen the motion and make it more robust, Mr. Speaker. And also, Mr. Speaker, being an East African and having seen what the summit has been, the decisions of the summit recently, and also the issues of Kiswahili and French, I'd like to start my submission here by giving a Kiswahili saying, which says, iliapo ngoma au ngoma inapopigwa Zanzibar, bara watu hucheza. Why am I saying so? Issues of universal health coverage, Mr. Speaker, as you know, the United Republic of Tanzania is a country, as it said, a united. So you have Zanzibar and you have Tanzania mainland. And I can assure you, Mr. Speaker, that in Zanzibar, we have universal health coverage. And in Zanzibar, there have been construction of 11 district, my sister was just speaking about district hospitals, district referral hospitals in the past 4 years, Mr. Speaker. So we have a good example, and others are emulating from that, because it's not only the legislation, but it is the practice. And we are having people from outside Zanzibar, and even from outside from Tanzania, even outside Tanzania, coming to Zanzibar to get medical services. I mean, they come there, and because also, Mr. Speaker, as you will see, that my brother, Honorable Kega here, and even my brother, Honorable Odongo, when making their submissions, they were talking that my health is my wealth. We want, for us to prosper, for us to become, to achieve the development we want, we need to have a healthy society. So, Mr. Speaker, as you had said that we should be very minimal in our submissions and try to economize the use of many words. Mine is just to make a proposal that when we are having in the prayers of this motion to the council, we add D and E. And D is to make a policy pronunciation that access to health services is a human right in the EAC. Because we all know everybody needs to have access to health services. And so it has to be pronounced by the council that this is a human right and we have to live it in our community. And E, we're talking about portability of health benefits. My brother from another mother, Honorable Maina Karobia, is moving a motion, which I'm seconding, on issue of motor vehicles insurance. Now, this one is coming on issues of health coverage. And he's trying to talk about portability of benefits in motor vehicle insurance. But I think this one for health coverage also demands that we have portability of benefits. Although we have some kind of portability in private insurance, like the way Jubilee, I can go to Kenya and get treated. I can go to Uganda and get treated. That is a health, it's a private one. So if we can see how we can mainstream more people to be in the coverage. So what we are saying in the E, we should have the council to work to attain portable benefits in health insurance. That is E. And with that, Mr. Speaker, I beg to submit. Thank you very much.
Thank you. The next is Honorable Matthias.
Thank you, Right Honorable Speaker, for giving me this opportunity to add my voice to that of my colleagues. Right Honorable Speaker, honorable members, the status globally of the universal health coverage is that you are off track. And we wouldn't sincerely, significantly achieve some progress if we don't move quickly and mobilize everyone and everybody. We have had even some serious shortfalls between the year 2015 and 2021, where the proportion of the population not covered by the essential services decreased of about 15%. So if we narrow this to this global pattern, to our continent, to our global, to our regional economic bloc, which is EAC, the question is, where are we? Where do we want to go? So the facts are that, and they have been more elaborated by my colleagues, most countries in the EAC have integrated universal health coverage as a goal in their national health strategies. But the progress in translating this commitment into expanded domestic resources for health, effective development assistance, and ultimately equitable and quality health services has been so slow. It's a fact. Though we do have limited countries, limited partner states who are on a good pace, and this can inspire all of us, and we can help one each other. Now, it is true, not one size fits all, but we have also to agree that partner state should at least focus on strengthening primary health care first, and the foundation as the foundation, and then we have to embark on addressing common regional challenges, mainly building on equity and focused approaches. Mr. Speaker, sir, honorable members, this is not just a matter of time. I think it is about political will. It's about strategic choices and sustained commitment. Time alone won't deliver universal health coverage in our region. And what happens during this time matters enormously. Right, Honorable Speaker, honorable members, as I conclude, I echo Honorable Ambassador Fatuma Ndangiza and seconders to this motion and strongly urge the partner state and the council to honor our commitment and fast track the attainment of the universal health coverage in our community for the betterment of our people. Honorable Speaker, Right Honorable Speaker, I strongly support this motion, which comes timely, and I beg to submit. Thank you.
Thank you. Honorable Katwamba and Gladness.
Honorable Speaker, thank you for the opportunity to make my contribution. I would like also to thank the mover of the motion, Ambassador Ndagiza. And right from the beginning, I support the motion for fast-tracking the universal health coverage. Mr. Speaker, sir, what is universal health coverage? It is a protection against possible illness. And provided that you are a human being, all of us are potential candidates for illness. And therefore, emphasize that the universal health insurance should be, at least in our region, the human right. Lastly, I'm skeptical on the Abuja declaration of 50% of the national budget. We should not put much focus on 15% because it won't be possible. And the reason of my skepticism is that the health is also related to other things. The health is also related to food production, stable income, good education, sports, infrastructure, and other things. So I support the motion, but we should think about the Abuja declaration. 15% is not practical. Thank you, Speaker, sir.
Thank you. Madness.
All right, Honorable Speaker, thank you so much for this opportunity to contribute on this important motion. And I support the motion and I congratulate Honorable Fatuma for bringing this topical issue in our platform. First of all, we all agree that universal health coverage is very important and it can never be avoided as it's a human right. But I want to take this opportunity also to appreciate the efforts of our countries, our governments, for the improvements and for the strengthening of the health systems. We all know that there is progress being made. The universal health coverage, this is a vision. It's not an output. It is not a process. So this is a vision that we expect to achieve. And as we have heard from different countries, like in Tanzania, yes, we've passed the act. There are initiatives in Rwanda and different countries. But in most cases, most of our countries, when we talk of the universal health coverage, we are mainly addressing the financing aspect. That's where we are talking about insurance coverage. Yeah, we have the national insurance schemes. We have the community-based schemes, the same as the one in Rwanda. But ideally, if we really want to achieve this, we need to really go broader and in-depth into understanding that it's not enough just to address the financing aspect, but we need to think of the service coverage itself. We need to think of the population and the equity aspects as far as access to health is concerned. I'm saying this because currently, yes, we have increased population as far as coverage in insurance, but at the same time, this same population does not have access to the health services that they actually require. So I think it's very important that we continue the debate on how do we make sure that when we talk about universal health coverage, we are actually addressing the service as a unit of our attention. That is one. But from the recommendations that were brought out, Right Honorable Speaker, I would like also to request the motion mover to include the aspect of learning. We are in the community and we are different steps as far as universal health coverage is concerned. So I would like to request that we have another recommendation on monitoring, evaluation, and learning. That how do we ensure that we learn from each other? Because we want to move as a community. So that is one aspect that I think is very important that we bring on board. But at the same time, I think it's high time that we look at the community as our opportunity to support this initiative. For example, we all understand that currently the cost of service delivery is very high. And one of the aspects that is contributing to that is procurement of the medical inputs and medical commodities. So I think it's high time that we urge the Council of Ministers to promote pooled procurement strategies or joint procurement strategies, that we take advantage of the population and the market that we have so that we can reduce the cost of the medical inputs, because that is something that is really a constraint for our countries to achieve our universal health coverage. But at the same time, I was asking myself, do we know what we have in the community as far as health services are concerned? When I was listening to Honorable Siranda, then I was asking myself, have we exhausted what we have in the community? Do we know what is available in the community as far as the experts in terms of qualifications, but also in terms of the service providers? So I think it's high time that we come to, I don't know how to call it, but we really need to profile what we have in the community. And that one will provide or will help us to make sure that we improve the access by minimizing the cost. Maybe one will not need to travel very far, they'll just need to cross the border. And for that case, we are taking advantage of the other initiatives that are supporting our integration. So, right, Honorable Speaker, I commend Honorable Fatuma for this particular motion, but I would like to urge the Council of Ministers to look at it in a very holistic manner, in such a manner that we take advantage of what we have as opportunities in our community. Thank you, Speaker.
Thank you, Honorable Dr. Gladness. Now we give the floor to Honorable Minister if he needs to contribute.
Thank you, Mr. Honorable Speaker, and the members who have spoken of the motion. I recognize that the motion itself is very specific. It enjoins the Council of Ministers to fast track. So I can just do it, quote something. But urge the Council of Ministers and partner states to fast track the attainment of universal health coverage. So far as I've been here, also uniting with this house today, because I've not been here for a very long time. I'm glad to be here to express my unity. I will note that there has been no dissenting opinion on the question. Consequently, I do not expect the House to hear from me of any idea about discouraging the motion. The motion itself is straightforward. It does not detail or bring controversial questions of misrule into the area of health, public health, of doing health. It demands that we should it actually encourages the Council of Ministers to do their work of ensuring that they attain universal health. So that's the real complementary. So I would therefore not expect that this is now without prejudicing or preempting what Council of Ministers might say. I can only say that I am sure they will not be horrified by this motion itself. The motion is about uniting Africa with the life of its citizens. Each time we're talking about unity, most of sometimes we tend to abstract unity from its real needs. The unity we're talking about is get Africans to be united with Africa. People's life to be united with the good life, with the health. Unite people with the resources. Unite them with themselves. This is really what unity is about. Therefore, anything which is going towards that direction, I'm sure will be very much welcomed by the Council of Ministers. Therefore, I therefore wish to say that I'll be here to represent these very sentiments which you are expressing here in the Council of Ministers, and I'm sure they will give it better flesh, more flesh, and the architecture to enrich it and bring you back good results. Thank you very much.
Thank you. Thank you, Honorable Minister. Now, Honorable Ndangiza, you have the floor.
Thank you, Right Honorable Speaker. At the outset, I'd like to really thank the members and our council member who have eloquently debated this motion, but also overwhelmingly supported it. I enjoyed listening to each and every one of you. Very brilliant ideas, but you also brought about critical issues that serve as recommendation to enrich this motion, but even future legislation and policy making for the region, like the issue of domestic financing. It came out strongly. We shouldn't wait for external support. As East Africans, we should prioritize health. And all members came back to the issue that health is wealth, and a strong link between a healthy society and productive society, but also the welfare and economic growth of our community. Health is also linked to security, and it is critical to regional integration. There was also an issue of investing in our healthcare system and look at it comprehensively, especially improving on the quality of our healthcare services, that we should invest in our people and provide the enabling environment in terms of facilities so that we don't have brain drain outside our region. And this was eloquently raised by Honorable Dr. Siranda. The issue of ensuring that we bring coordination or strengthen the various the various insurances, both government, private insurances, and also reduce on the inequalities between the two systems was also raised. So and then there is also the issue of sharing best practices. I think it was Honorable Dr. Gladness, monitoring, evaluation, but also learning from each other. Then there was also, it is also noted that all countries are committed, and I'm sure even honorable colleagues who didn't have an opportunity to speak, they have a lot to share with us, what is being done, the case of Uganda, the preventive medicine, and also the need really to make universal health coverage work. So again, the call to the council was loud and clear to fast track the attainment of universal health coverage. And we are not building from scratch. A lot has been done at the level of the community in terms of policy strategies, but the question has been implementation. So with those remarks, I really want to thank the seconders. But before that, let me also accept the two amendments that were made, one by Honorable Sankok, that universal health coverage should be accessible to all citizens, including persons with disabilities, in terms of building an environment that is devoid of stigma. I support this amendment to the motion. The second one is the training of healthcare personnel must not be commercialized. It should be government-sponsored purely based on merits and competence. I also support this amendment, very important. Honorable Dr. Makambe also made some amendments in terms of adding to the prayers to the council. One is policy pronunciation, that access to health is a human right in East Africa. E, to attain possibility of health insurance and coverage benefits under the ES Universal Health Insurance. Then Honorable Dr. Gladness also made an amendment on recommendation, adding another recommendation of the Council of Ministers to put in place a framework for monitoring, evaluation, and benchmarking or learning from each other's experiences. So I accept the amendments to enrich the motion. And with that, allow me, honorable members, to recognize all the members who have made, who have seconded the motion. But I know even those who didn't stand up support the motion is because time was not on our side. So Honorable Kanini Kega, who seconded the motion, thank you so much. Honorable Dr. Siranda, Honorable Caroline, Honorable Sankok, Honorable Odong, Honorable Mary Mugenyi, Honorable Shahbal, Honorable Clement, Honorable Dr. Makame, Honorable Ambassador Dr. Matthias, Honorable Kachwamba, Honorable Dr. Gladness, and our council member. Thank you, honorable colleagues.
Thank you. Honorable members, I now have to put the question that this assembly do resolve to urge the East African Council of Ministers and Partner States to fast track the attainment of universal health coverage. This was the motion that was there before, but it has been amended. So they will retain this motion as it has been amended. Those in favor say aye. Aye. Those to the contrary say nay. The ayes have it. Yes, Honorable Sankok.
Honorable Speaker, I rise on our rules and procedure rule 30 L.
30
L.
L.
Any motion on urgent matters of public importance supported by 1/3 of the members present. A motion without notice.
A motion without notice?
Yes, I want to move a motion without notice.
Yes, you have the floor. You can proceed.
Thank you very much, Honorable Speaker.
30
30L.
30L, which is any motion on urgent matters of public importance supported by 1/3 of the members present.
Yes, Honorable Speaker, the motion is for the resolution of the Assembly urging the Council of Ministers to formulate a policy on payment of salaries and remuneration to be paid directly to persons in service of the community from their respective sending partner states, and also recommend to the summit to sanction partner states that have defaulted in their financial obligation.
So I would like to get it well because it is too long and then.
Can I repeat? Can I repeat? Can I repeat, Honorable Speaker?
Honorable Sankok, I need to capture it well.
Procedure, Honorable Speaker.
Let me repeat.
Procedure.
Honorable Kimga, he is on the floor.
I'm writing procedure. Point of procedure.
We must first
I'm writing
finish.
point of procedure, Honorable Speaker.
I must first finish him because he was also there.
I'm writing point of procedure based on a rule of procedure, Honorable Speaker.
Honorable Speaker, I have said is a motion for a resolution of the Assembly.
Procedure,
Council of Ministers
procedure, Honorable Speaker.
To formulate a policy on payment of salaries and remuneration to be paid.
You'll get it, wait, you'll get it.
Directly to persons in service of the community from the respective sending partner states, and also recommend to the summit to sanction partner states that have defaulted in their financial obligations.
Honorable Speaker, procedure.
Thank you. Now,
Honorable Speaker.
Now I give you the floor.
Thank you very much, Honorable Speaker. My good friend, Honorable Sonkok, is raising a motion under Rule 30L, which is an urgent matter. Issue of the salary, it is a matter of the treaty. It's not an urgent matter for the community. He can raise and move his motion through procedural matter, raise to the commission, and then present to the House by his own concern. This matter, it is not an urgent matter, Honorable Speaker.
It's not. Honorable Speaker,
Check the treaty and the.
Honorable Speaker.
It's not an urgent matter.
Yes.
This matter is very urgent.
No.
When members go without salary for some time, when staff are not paid, when some contracts have been terminated, it is surely an urgent matter of concern, especially for the paying states who feel that their taxes.
Honorable Sankok?
Yes.
Honorable Sankok?
Yes, sir.
We had a council meeting 3 weeks ago. And what you are raising was and still is on the agenda. Meaning that what you are raising is already on the table. And the next meeting is when? 17 or 13? Why don't you hold this and let the Council of Ministers discuss it and decide?
Honorable Speaker, when it comes to a motion without notice, it is not stipulated here that whether it is before the council By the way, I'm not a member of the council. Whether it is before the council or it is before the summit, it is just that a motion without notice. And I've probably moved the motion without notice. Is if I'm supported by 1/3 of the members, and I continue to justify my motion.
But we can proceed it. Do you have seconders?
Yes.
Do you have seconders? No seconder. So it's gone. We proceed with.
Thank you very much, Honorable Speaker. I accept that I have no seconders.
Yes.
Yes.
Next
Duly
item.
accepted.
We proceed. Clerk.
We proceed to item 3, motion seeking leave of the assembly to introduce a bill to provide regional measures to prevent illicit financial flows into the community by way of motion.
Honorable Kennedy.
Thank you so much, Right Honorable Speaker. Right Honorable Speaker, pursuant to Article 49(2)(d) and Article 59(1), Chapter 14 of the treaty, and Rule 64 of the Rules of Procedure of this Assembly, I beg to move a motion seeking leave of the Assembly to introduce a private member's bill that provides measures for preventing illicit financial flows from the East African community. I beg to move. Seconders.
Proceed. You have seconders?
Yes.
Who are they? Honorable Francine, Honorable Kibera, Clement, and others.
Thank you so much, Right Honorable Speaker. Right Honorable Speaker, whereas pursuant to Article 81(2) of the treaty, the partner states undertook to cooperate in monetary and fiscal matters in order to establish monetary stability within the community and facilitate economic integration and the attainment of sustainable economic development of the community. And whereas under Article 83 of the treaty, Article 30 of the Protocol on the Establishment of the East African Common Market Protocol, and Article 22 of the Protocol on the Establishment of the East African Community Monetary Union, the partner states agree to harmonize and coordinate their economic and monetary policies. Recognizing the global challenges of illicit financial flows and their impact on sustainable development for the partner states, the community, and the continent at large, whereas illicit financial flows refers, which is very important, to money which is illegally earned, transferred, or utilized. The actual funds typically originate from 3 sources, namely commercial tax evasion, trade misinvoicing, and abusive transfers, pricing, criminal activities, including drug trade, human trafficking, illegal arms dealing, and smuggling of contraband, and bribery and theft by corruption. Nothing with appreciation the efforts of the African Union Commission, the United Nations Economic Commission for Africa, and the African Ministers of Finance, Planning, and Economic Development in establishing the high-level panel on illicit financial flow from Africa that is chaired by the former president of South Africa, His Excellency Thabo Mbeki. Further aware that the areas needing priority interventions are linked to existing legal frameworks and policies, harmful tax complexion or competition, tax evasion and tax avoidance, public debt management, and corporate transparency and accountability, especially in the extractive sector. Concern that the high correlation between reliance on extractive industries and illicit financial flows impact on the development and inequality within the community, and the dependence of partner states on natural resources extraction make them vulnerable to illicit financial flows. Further, concern that illicit financial flows are major hindrance to effective domestic resource mobilization into the community, Yet there is ineffective legislation, regulatory frameworks, and institutional policies to combat illicit financial flows. Noting that illicit financial flows from Africa are large and increasing, new and innovative means of generating illicit financial flows are emerging, and corruption and abuse of entrusted power remains a continuing concern. Convinced that combating illicit financial flows, which is a political responsibility of the Council and the partner states, and successful efforts will generate a positive impact on the governance of the community and results in sustainable improvement and enhancement of the local businesses and private sector development and investment environment within the community that strives well. Further convinced that preventing illicit financial flows by the community and the partner states will contribute to strengthening capacity as well as fostering increased domestic resource mobilization into the community, increased benefits by the economies of the partner states from the multiplier effect of the domestic use of such resources, whether for consumption or for investment, and creation of more jobs opportunities from the previously illicit transfers. Conscious that some of the recommendations made by the high-level panel on illicit financial flows from Africa, shared by His Excellency Thabo Mbeki, includes the following: improving governance and accountability through ending obscure and badly structured contracts, denying legitimate earnings from royalties or tax, developing a legislative capacity to curb financial flows, which are illicit, strengthening regulatory capacities and resourcing of tax and customs, promoting global cooperation and transparency to stop aggressive tax avoidance and trade mispricing, making available tax information, accounts of sales, profits, taxes paid by mining companies, declaration of beneficial ownership in commercial entities, and supporting international cooperation in regulatory laws and systems, reform including harmonizing anti-money laundering laws and double taxation treaties to avoid double taxation. Cognizant of the provision of Article 49(2)(d) of the treaty, which empowers the Assembly to discuss any matter pertaining to the treaty and making recommendation to the Council, recognizing that under Article 59(1) of the treaty, any member may propose any motion or introduce any bill into the Assembly, cognizant of the previous provisions of Rule 64(5) of the Rules of Procedure of this Assembly, which requires a private member's bill shall be introduced first by way of motion, to which shall be attached the proposed draft bill of the bill. Honorable members, the proposed draft bill is in your emails and is attached to the motion. Now, therefore, be it resolved by this Assembly as follows: that in accordance with Article 59(1) of the treaty and Rule 64(5) of the Rules of Procedure of this Assembly, that this Assembly grants leave to Honorable Kennedy Mukulia to introduce a bill to provide for regional measures to prevent illicit financial flows from the community, to institutionalize the recommendation of the high-level panel on illicit financial flows from Africa that was chaired by His Excellency Thabo Mbeki. I move, Mr. Speaker, sir.
Thank you, Honorable Mukulia. It's now time for you to justify your motion. Have you finished with justifying it?
Right, Honorable Speaker, I want to allow the seconder of the motion to justify it so that we can be able to cut down on time.
Thank you.
Thank you.
Honorable Maina, the seconder, you have the floor.
Thank you, Right Honorable Speaker, for this opportunity. The reason as to why we are moving this motion, and as a matter of justification, is to ensure that our region becomes a hub of transparency this region becomes free of money and funds and resources that would deepen our, or would affect how we conduct our financial flows and capital flows within our region. Right, Honorable Speaker, you realize in the international financial markets, countries are always ranked on the index of how least corrupt they are or how transparent those countries are. This particular bill that we seek to introduce to this House, sponsored by my good friend Honorable Mukulia and myself, seeks to ensure that we build a community that is transparent and a community that can be seen in the international markets or international financial market as a region that is free of corruption, free of all manners of conduct and actions and commissions and omissions that would otherwise undermine the hard work of our citizens and the hard work of many investors that come to our country or to our region. So, Right Honorable Speaker, I beg this able House to grant us this leave to introduce this particular bill, because it's a progressive bill and it's a bill that I know we are going to benefit now and to posterity, because it seeks to protect the financial market of this region. Thank you, Right Honorable Speaker.
Thank you. Thank you, Honorable Maina. Now, honorable members, the motion on the floor is that this assembly do grant leave to Honorable Ason Kennedy Mukulia to introduce a bill on regional measures to prevent illicit financial flows into the community. Debate is open. As the seconder has already contributed, I give the floor to maximum 3 members because we'll debate properly again. So I give the floor to Honorable Clement and Honorable Kibeya. That's all. You have the floor.
Right, Honorable Speaker, honorable members, I raise to strongly support this motion moved by Honorable Kennedy Ayason and seconded by Honorable Maina Karobia, seeking leave of the House to introduce a private member's bill on ESC prevention of illicit financial flows. This proposed legislation is both timely and necessary for the survival, stability, and effective transformation of our region. Illicit financial flows have become a major threat to the economic growth, good governance, and integration agenda of the East African community. Every year, for example, Africa loses an estimated of $88.6 billion through illicit financial flows, according to the United Nations Conference on Trade and Development. A significant portion of these losses is traced to tax evasion, trade misinvoicing, corruption, money laundering, among others. Sadly, East Africa has not been spared. These leakages rob our partner states of much needed revenues that could finance universal health coverage we're talking about shortly, education, infrastructure, and industrialization as well. However, the cross-border nature of illicit financial flows means that the national level interventions alone are insufficient. What is urgently needed is harmonized, legally binding regional framework that promote coordination, information sharing, and enforcement across partner states. This bill, once introduced and debated, seek to inter alia establish a regional legal framework to prevent, detect, and combat illicit financial flows in line with international conventions such as the United Convention Against Corruption and the African Convention on Preventing and Combating Corruption as well. It will also promote transparency in financial systems by strengthening disclosure requirements, beneficial ownership registers, and regional reporting standards. It will also, Right Honorable Speaker, enhance cooperation and capacity building among partner states, tax authorities, financial intelligence units, customs bodies, and the law enforcement agencies. It will provide also for regional sanctions and the remedies against individuals, companies, and the networks engaged in illicit financial flows. Right Honorable Speaker, honorable members, this House has a responsibility to act decisively by granting leave to Honorable Kennedy Mukuria to introduce this bill. We will be making a historic step towards safeguarding our resources, strengthening our integration agenda, and ensuring that the wealth of East Africa benefits its citizens and not a few criminal networks. I therefore call upon honorable members to support this motion. Together, let us stand firm against illicit financial flows and build more transparent, accountable, and prosperous East African community. I thank you.
Thank you, Honorable Clement. Now I give the floor to the next, who is the next, Dr. Kibeya.
I thank you, Right Honorable Speaker, for giving me this opportunity to add my voice in fully supporting this question from Honorable Kennedy Mukulia, seeking leave of the Assembly to introduce a bill to provide regional measures to prevent illicit financial flows into the community. I take reference to the effort from partner states for regional integration, mainly two aspects: monetary union and now the common market. We all know that our central banks made some arrangement to improve payment systems in our region, mostly maybe Burundian transacting with a Kenyan and paying in Bujumbura with Burundi francs, and the Kenyan receiving the money from a Burundian in Kenya shillings. This is a good achievement. We may recall that we have still our economies counting a big percentage with the informal sector. And without a more improved transparency and governance in payment systems, we may fall with some difficulties or some critics aspects for those investing in our region or for movement of investment between countries, mainly in an aspect that was pointed here by the bill, the extractive sector. I support this bill because while we are evolving to the legal and institutional infrastructure for monetary union and to support free movement of capital in this area, we have improved the aspects of national laws about anti-laundering money and counter-terrorism to have a regional aspect to protect our investors in this aspect and our capital movement in the movement of capital in our region. That is why, Honorable Speaker, I fully support this bill from Honorable Mukulia, and I beg to submit.
Thank you, Honorable Said Kibeya. Honorable Farada, you requested the floor.
Speaker, thank you for giving me this opportunity. I rise to support the motion seeking the Assembly to introduce the bill aimed to providing regional measures to prevent illicit financial flows brought by Honorable Mukulia. and it's a very timely motion. The importance of addressing the illicit financial flows include the tax evasions, the money laundering, and the illegal transfer of funds across the borders, undermine the economic stability and development of our partner states. These flows reduce the resources available for critical investment in like health, education, and infrastructure and social services. By tackling the IFFS at the regional level, we strengthen the financial integrity and credibility of East Africa community. Need for regional legal framework. While the partner states have national laws to address the illicit financial flows, the transitional nature of these flows calls for harmonized regional approach and a regional legal framework and contribution to sustainable development. The East Africa Vision 2050 and sustainable development goals emphasize good governance, transparency, and accountability. By curbing these illicit financial flows, this bill will ensure that the public resources are mobilized and retained within the region, contributing directly to poverty reduction, job creation, and economic growth. And Mr. Speaker, I stand to support. Thank you.
Thank you, Honorable Falada. Honorable Minister, do you have a remark? But we have already finished.
I will know. I think this is the prerogative of the House.
If you have any, we will proceed.
But I don't have any objection to. And it's
Thank you.
The House is exercising its prerogative.
Thank you. Honorable members, I now give the floor to Honorable Mukulia to reply.
Thank you so much. If you may allow, Right Honorable Speaker, the seconder wants to say one thing. So if you may allow just 1 minute.
The seconder, he's not allowed. It's now you.
Okay, thank you so much, Right Honorable Speaker. Right Honorable Speaker, and I just want to say thank you, members who supported the leave of the House. I want to say one thing, that illicit financial flow is very dangerous into the community. And somebody mentioned here things to do with misinvoicing. Right Honorable Speaker, with illicit financial flow, for instance, a company will be registered in safe havens, and those safe havens include places like, say, Ireland. It also include places like, for instance, Switzerland, where a parent company exists there. And they will register a company, for instance, in any of the East African countries, let me say in Mogadishu. And when people trade in that company, much of the money goes back to the parent company in terms of royalties. So for instance, if they make $10 billion, they will declare to the national government $3 million. And the $7 million sits in offshore account. And it will be divided in terms of salaries, it will be divided in terms of royalties, and then it will go to another company that might be based in, say, in the islands. And at the end of the day, our countries miss to get the required resources to internally develop. And where does this illicit financial flow normally goes? It goes mostly from the extractive sector. Things to do with minerals, things to do with our oils, things to do with what? Equally, for instance, even the telecommunication companies, they will always making sure that their taxes are backed to where they are originating. And at the end of the day, it drives our governments to start taxing our own citizens when the companies that we do pay them in terms of taxes are evading taxes. Some of them even misinvoice. For instance, a commodity costs $1 million. They misinvoice it to be 300,000 United States dollars. You pay them $1 million, they declare only 300,000, and the government tax only 300,000, losing much more resources. All these monies will have been used for the development of health sector, education sector. And if we are able to provide much more legal framework to avoid IFF, which someone says here contributes to 98%, 98 billion from the continent every year. And it's a very big problem. All these monies will have made our countries to be able to provide service. I want to take this opportunity to thank Honorable Maina, who is the seconder of this motion. Maina, thank you so much. Honorable Clement, I know you're a crusader of anti-corruption, and that was under your docket, very important. Thank you, Honorable Kibea, also for supporting. And lastly, I want to thank Honorable Falhada for supporting. I know we had this small thing this morning, and I want to say sorry so much. And this is what it means. And we are all colleagues in the area of legislation, and we should support each other in one way or the other. I want to say thank you so much for understanding, and my apologies to you if I hurt you one way or the other. Thank you so much. So, Mr. Speaker, sir, I want to thank also the minister for accepting, for being the only minister around. You know, we don't have the ministers around. In fact, we also don't have CTC around here. We don't have, Secretary General around. So thank you for standing for the council and for supporting this assembly. We do appreciate your presence. Thank you.
Thank you, honorable members. I put the question that this assembly to grant leave to Honorable S. Kennedy Mukulia to introduce a bill on regional measures to prevent illicit financial flows into the community. Those in favor say aye. Those to the contrary say nay. The ayes have it. Honorable members, I want to remind you, Article 37 in our rules of procedure and of our assembly. Article 37 in item number 6 says, a member shall not read his or her speech, but may read short extracts from written and printed papers in support of his or her argument, and may refresh his or her memory by reference to notes. I have been watching that the members as reading a book they have been stuck on the writings, so this is a reminder. With this, we proceed.
We proceed item 5, motion for a resolution of the Assembly commending EAC partner states for successfully hosting continental and international sports activities by way of motion.
Honorable Falada.
And Honorable Speaker, I am moving a motion for a resolution of the Assembly commending partner states for successfully and hosting continental and international sports activity moved under Article 49(2)(d), 59(1), 119(a), and H of the treaty and Rule 26 of the Rules of Procedure of the Assembly. Whereas the partner state undertook
the entire house, Sanko, Francine, you can proceed.
Whereas the partner state undertook the Article 119 of the treaty to cooperate in promotion and enhancement of diverse sports activities and any other activities aimed at promoting the East Africa identity. Whereas the Republic of Kenya, Republic of Uganda, United Republic of Tanzania hosted the African Nation Championship, CHAN 2025 in August 2025, and the Republic of Rwanda hosted the Union Cycliste Internationale UCI Road World Championship in Kigali from 21st to 28th of September 2025. Recognizing the role of sport in demonstrating and showcasing the heritage, natural beauty, and cultural diversity of East Africa, further recognizing that sports are a unifying factor in the community, fostering regional integration, cultural exchange, youth empowerment, tourism promotion, and socio-economic development. Appreciating the partner states for investment in sport infrastructure and accommodation facilities that continue to attract continental and international events and activities and tourists to the community, which have become enduring landmark in the landscape of the community. Congratulating the Kenya Football Federation, KFF, and the Federation of Uganda Football Association, FUFA, and the Tanzanian Football Federation, TFF, for successfully hosting the African Nations Championship, CHAN 2025. Applauding the Republic of Rwanda for successfully hosting the Union Cyclist International, UCI, Road World Championship in Kigali, marking the first time this global competition was hosted on Africa soil, and thereby elevating the status of the Africa community on global sporting stage. Convinced that hosting continental and international sports events and activity has enormous social and economic benefits to the community and provide all the partner states with platform to showcase the natural resources and the beauty, culture, hospitality, tourism, and investment potential of the partner states. Further convinced that by hosting international sports events, partner states showcase and demonstrate on the global stage the individual and collective capacity and potential of the partner states, and continue to position East Africa as a global hub for international sports events. Aware that Article 492D of the treaty, the Assembly may discuss any matter pertaining to the community. Now, therefore, be it resolved by the Assembly as follows: that in accordance to Article 492D and 119 of the treaty, the Assembly commend the Republic of Kenya, Republic of Uganda, the United Republic of Tanzania for successfully hosting the Football African Nation Championship CHAN 2025. To congratulate the Republic of Rwanda for hosting the 2025 Union Cyclist International UCI Road World Championship. Congratulate Football Kenya Federation, Federal of Uganda Football Association, and Tanzania Football Federation for the successful hosting of the African Nation Championship, CHAN 2025. Congratulates the Harambee Stars, the Uganda Cranes, and the Taifa Star for qualifying the reaching the quarterfinals of the African Nation Champions CHAN 2025, showcasing the domestic talents available in the national leagues and bringing pride to the community through their football prowess. Moved by me, seconded by Honorable Clement. I beg to move, Mr. Speaker.
Thank you. You can justify your motion now.
Honorable Speaker, sports are more than just the games. They are a unifying force that transcend political culture and linguistic boundaries. When our partner state host major tournaments, be it athletic championships, football qualifiers, rugby tournaments, or any other continental competitions, they send a clear message to the world that East Africa is a region of peace, talent, and opportunity. The successful hosting of this event, Mr. Speaker, demonstrates the capability and readiness of our partner states to manage large-scale international engagement. It showcases the hospitality, the strength of our economies, and build the image of East Africa as vibrant and stable region. Allow me particularly to commend the government and citizens of the partner states that have recently hosted the major sporting events. Through their commitment, organizations, collaborations, they have not only brought pride to the nations, but also strengthened the spirit of East Africa community. These events have tangible benefits beyond the games themselves, Mr. Speaker. They boost local economies, create jobs for our young people, and stimulate tourism. Our hotels were filled, the local transport thrives, the small business flourish. Moreover, they leave behind improved infrastructure, stadiums, roads, and training facilities, which continue to serve our youth and communities for years to come. It is also important to recognize the power of sports in promoting youth empowerment and social transformation. Sports have become a platform where our young people showcase their abilities, gain exposure, and build careers. Many of our regional athletes have become global icons, ambassadors of peace, unity, and excellence. Sport also play a vital role in promoting gender equality. We have seen women athletes across East Africa breaking barriers and setting new records, inspiring millions of girls believing that their dreams are valid and achievable. This motion should therefore inspire us to go further. As we recommend the partner state, let us also call for strong collaboration within East Africa to institutionalize sport as the key pillar of regional integration. I propose that East Africa Secretariat develop a sport development framework to harmonize policies, invest in talent exchange programs, and support the hosting of regional tournaments such as East Africa Games on the rational basis. Thank you, Mr. Speaker. I beg to submit.
Thank you, Honorable Falada, the mover.
Mover is Clement. No, not the mover, the seconder, sorry, it's Clement.
He will get an opportunity when we will start debating. He'll be the number one. So, honorable members, the motion on the floor is that this assembly do resolve to commend EAC partner states for successfully hosting continental international sports activity. Debate is open, and we start by the seconder, who is Honorable Clement.
Thank you, Right Honorable Speaker, for this opportunity. I hope that as the seconder of this motion, I'm allowed to use my vade mecum. Right Honorable Speaker, honorable members, I raise to second the motion so ably moved for a resolution of this assembly commending the successful hosting of continental and international sporting events, notably AFCON Pamoja and the UCI Road Worship Championships. These two big events have demonstrated the world that our region is capable of organizing and delivering world-class competitions in line with the highest international standards. They have united our peoples, showcased our culture and hospitality, and provided tangible evidence of the strength and resilience of the East African spirit. Right, Honorable Speaker, honorable members, this assembly therefore lightly resolves to commend the efforts of partner states, the sectoral councils, the sports federations, and the citizens of the East African community for their unavailable contribution to these achievements. Further, we call upon our governments to consolidate these gains by strengthening sports infrastructure, harmonizing policies in sports and education, and ensuring that our region continues to be a preferred destination for global sporting activities. Right, Honorable Speaker, honorable members, I have a dream that one partner state in our region will host one day Formula One, and one of the biggest football clubs like Arsenal or Paris Saint-Germain, among others. The UCI Road World Championship were organized for the first time in Africa, hosted by the government of Rwanda from the 21st to 28th September this year. This historic event brought together participants from 108 nations, including 38 teams from Europe, 38 teams from Africa, 35 from Europe, 20 from America, 16 from Asia, and 3 from Oceans. The championship received the global broadcaster coverage in 124 countries and attracted an estimated television viewers, 330 million television viewers, making a milestone achievement for both Rwanda and the African continent in the history of international circling. Right, Honorable Speaker, honorable members, with those few remarks, I beg to second.
Thank you. Thank you, the seconder. Now we'll give the floor to some members to support, because all of us, you can support. It was a successful event, and let's give it to some so that we can, it is almost 6 o'clock. So we start by Honorable Maina, Honorable Kadogo, Honorable Kim, Honorable Gideon, and Dr. Black.
Yes, thank you, Right Honorable Speaker. I want to first of all congratulate the Honorable Falhada Iman for moving this motion together with my good friend, the seconder, the Honorable Clement Musangabatware, for bringing this motion. Right Honorable Speaker, one, there are two ways that you can develop as a human being in this world, in the modern world. Number one is professionally, in line with your profession, the professional work that we do. And number two is through our talents. Right Honorable Speaker, the fact that we as East Africans are hosting these games, and I'm speaking from the point of the kind of games we are hosting, the CHAN, what the Honorable Musangabatore has said, the AFCON that is coming in 2027, all these games, they speak to us as policymakers and lawmakers that we need to mobilize our people towards not only targeting what you'd call the big professions, politicians, doctors, teachers, accountants, lawyers. We need to mobilize our people to also the talent line or the talent development. And it is my prayer that with this particular motion, it is going to speak to our Council of Ministers, our governments, that we need to start developing safe spaces and centers of excellence in our respective countries and in our region, so that we can develop the talents of our people. If you look at in fact, I was just checking here. If you look at the revenue that was generated by the football clubs, and I know, Right Honorable Speaker, you are a fan and a supporter of these globally acclaimed football clubs. If you look at the kind of revenue they are generating, it's almost like our national budgets in our countries. So, and this speaks to what talent can do. Right Honorable Speaker, if you look at the salaries that are paid to these footballers, Right Honorable Speaker, you'll bear me witness that we need to be serious about talent development. And I like the fact that our countries are in line with our integration process. They are not actually facing, or they are not actually looking for these hosting rights as individual countries, but they are actually facing the continent and the international football world or the sporting world as the East African. The Pamoja bid that was done by the United Republic of Tanzania, the Republic of Kenya, and the Republic of Uganda speaks as to how we as partner states within East Africa should be facing the world. If we want to host the athletics, let's go bid as East Africa so that we increase chances of winning these hosting rights. If you look at the World Cup of I think it will be on 2026. It will not be hosted in one country. It will be hosted in US, Mexico, all those countries. Why are they doing that? So that they can increase chances of winning the hosting rights. So, and I urge us as East Africa countries that we continue bidding for hosting rights of all competitions in the world as East African region, not as individual states. So congratulations, the Honorable Falhada, and this is timely. Let's continue developing our centers. Actually, out of the CHAN games, Right Honorable Speaker, what I've realized, there are so many players from East Africa that have been scouted and recruited by the European clubs. On Sunday, I was watching a certain player from Kenya called Ogam. He was recruited by Wolfsburg a club in Austria. And this is a talent that was recruited from these CHAN games. There are so many other players that were recruited. So let's continue urging our partner states and our governments to develop centers of excellence, because these are centers that are going to showcase our talents to the other continents and other on the global platform. Thank you, Right Honorable Speaker.
Thank you, Honorable Maina. Honorable Kadogo.
Thank you, Right Honorable Speaker, for giving me an opportunity to contribute on this motion. I stand to support the motion to commend the East Africa partner states for successful hosting continental and international sports activity. Kenya and Tanzania and Uganda have co-hosted a major continental football event, the African Nation Champions 2025, which serves as a qualifier for African Cup of Nations, AFCON 2027. The East Africa national teams and clubs have struggled to make a mark on the continental stage. And the last games have demonstrated that East Africa is ready to compete at a higher level. I therefore congratulate the East African countries for successfully hosting the African Nations Championship, that is the CHAN 2025. I therefore stand to support the motion, and congratulations to the mover, Honorable Falihada. Thank you.
Thank you, Honorable Kadogo. Now, Honorable Kimgai.
Thank you very much, Honorable Speaker. Honorable Speaker, also, I stand to support the motion. Although this motion had been brought in last year by Honorable Surrender, if I may, I may remember, but this is, as I'm a sport person, that I representing my whole country, the whole Sudan, for 9 years, leading volleyball captain for 9 years, 1998 until 2008, playing Libya, club in Yemen, Emirates, and Saudi Arabia. Honorable Speaker, the motion, because for some of us who have been international players, for hosting any competition in any country, he have his own rules. Number one is infrastructure. And I see my good sister, she forget that one in the mentioning that we need infrastructure. And infrastructure, putting infrastructure to hosting, like for example, in East Africa, where Honorable Farhada come in athletic. In Africa, we have only Ethiopia, Kenya, and now Uganda and Tanzania, they're doing well now in athletic. We did never host any athletic game in East Africa. The reason is the infrastructure are not there. The government also are not putting a lot of financial in those infrastructure. So I think Honorable Farhada engaging the council and East African community that we need to put a lot on where the international and the global are knowing us. For example, in athletic, East Africa, we are very good. Football, we are there. We are still hustling. Basketball now, we are leading in content because now the young nation now are coming up. Some of us now who are 2 meters and 10 cents. They're in Uganda, they're in Kenya, they're in Rwanda. So now the South Sudanese son and daughters, they're not going to represent South Sudan alone. They are going to represent Rwanda, Uganda, Kenya, wherever they are. So at least we need also to put in infrastructure in the sport that are going to make our region known by the region. So the issue of the infrastructure is the first one, because we don't have any mandate to seek to host international competition when the rule of competition are not applied to our region. So it is very recognized that the Kenyan, Uganda, and Tanzania are hosting, and now this is for the domestic players, and 2027 this is now all the international players, they will come and play for our football, which is a command. Now, right now, Speaker, the other one I want to add, hosting, even this Eala also. We are hosting East African sport, and it is going to happen in Kampala. And I want to add to what Honorable Falhada said in your own motion that for some of us who have been in Eala before, this parliament is only 63 members of parliament. Half of them are women, half are the old people, half also are not never playing any games. And we are the one who are hosting the game in this African community. So right now, Speaker, you are sitting in the bureau of the speakers. We have been playing in Eala 4 with the staff. In football, we have 7 members and 4 staff. In volleyball, we have 3 staff and 3 members of parliament in the field. Same to netball, women and men. Now, right now, Speaker, Eala cannot even constitute the team to play. And this is when now when it can risk, even this game can never continue in upcoming, and the council will not never supporting us. Therefore, I urge honorable members that the Eala should be given to support to play with the staff in upcoming games. So at least we can participate fully. We can participate fully when we speak up, because some of us, we have only now, like example now, we have only volleyball. Some of us, we are risking ourselves playing from morning until evening. Others are sleeping or even are enjoying in beach in Mombasa or in Zanzibar and somewhere else. And other partner states are playing. Parliament in South Sudan, there are 650, Uganda 550, Rwanda, and all of them, they cannot put us the same level one of speaker. See now, this motion have been brought by Honorable Falhada. It is in timely that Eala, an Honorable Minister, even also is our member, but even for himself, he cannot play. Because he's joining also the elders group. So right now, Speaker, we need also even to introduce new game like chess and full, that where people can play those games with any age that we are going to play. So, Honorable Father, these all are things that I want to include to your own motion, because it is inclusively, we're talking about the hosting, and Eala is the one that we are leading for hosting the games, and we are not seeing to participate women and men. Well, in Eala 4, we have been participating. We have very good team in Eala Women Net and Eala Women basketball. Same to men, volleyball, and men football and basketball. So, right now, Speaker, I think it is very important. We are going to be that in the bureau, and I wish all of us in Kampala will see Eala are playing all the game where we are going to host. I support the motion, Mr. Speaker. With those I mentioned, with those amendments that even with other can take it. Thank you very much.
Thank you. Next.
Thank you, Right Honorable. I stand to support the motion by Honorable Falhada. Let me add a voice to what has been said by my colleagues. I will be brief. Because the mover of the motion has really justified the motion, and it is speaking for itself. But otherwise, we are contributing to emphasize a few areas as I do. Right Honorable Speaker, sport is something which is something important that need our effort as a region to see into it that we invest in it. Somebody who is very passionate about sports and also a practitioner in sports, I believe that this region has the potential and talent to be developed and to be exploited properly, so that we are able to be competitive, not only in Africa, but globally. Honorable Falhada has brought this motion at the right time when the world is really busy in sport diplomacy. Sport diplomacy is nowadays the best diplomacy to win over interest and change behavior of others. We need to increase our parliamentary diplomacy to start with as East African region, we expand our sporting disciplines to accommodate the ages and also to show competitiveness as a region, because we lead by example. If we, the members of the East African community, can increase our interaction, participation, and engagement with our partner states, that will trickle down to lower levels of our society. There is a talent there that has not been tapped. We need it tapped. It cannot be tapped without awareness. It cannot be tapped without legislations. It cannot be tapped without resolutions by parliaments. So, Right Honorable Speaker, we urge our countries to increase investment in sports, especially sporting infrastructure, and also promoting disciplines that give competitive advantage to the region. Let's say, for example, Kenya is very good in athletics. Tanzania and Uganda have also come up very well. South Sudan now has shown that it is very good in basket. It was our pride when they were playing the Olympics. So these are talents that we need to exploit as a region, to use as our competitive advantage as we engage the world to host even the major events like the World Cup. If we can host the chant, we go to African Cup of Nations, why not to also have the ambition to host the World Cup? Because by the time we confirm that we can host the chant, we have now confirmed that we have hosted the chant, we can also be hosting the East African in 2027, the African Cup of Nations. So we can be ambitious to go for the World Cup in the future. The conditions that are required to host the World Cup by that time will not be failing as a region to meet those conditions. So, Right Honorable Speaker, while I'm concluding, I believe we as Eala need to do something in terms of our parliamentary sports. Because as I was the chair sometimes back for the interparliamentary games, the passion, the drive, the encouragement, the whole aspect of having the desire to do something among the Eala members is somehow slowed down by many factors. One is that there's no definite support for the sports from the community. Second is that we have been restrained by our own national parliaments to play our members only, where we know very well that our parliament is just a limp parliament. It's a parliament that has only a membership of 63 members. So now if you subtract the age, you subtract the other factors, and then you remain almost with members who cannot be competitive with this average age here, let's say 40, 45. If the average is 45, how can a 45 years person play for 2 weeks constant? Be kind of exhausted, extremely exhausted. So I think we need to revise something like reversing to the initial position that Eala need to play some staff. Or if Eala cannot play some staff, Eala could be donated from the members of parliament of our partner states. To increase us, then we'll be able to complete the game. Otherwise, it will be something like in the future, it may not be necessary for these games, and this would be a big blow to the region, because to promote parliamentary diplomacy and to also sensitize the community, we rely on these sports. It's part of a sensitization mechanism that we have in the parliament. Right Honorable Speaker, I support this motion. I thank you.
Good. Now the member Black.
Right Honorable Speaker, I want to appreciate you for the opportunity and appreciate both the mover of the motion, the Honorable Farahada, Eko Imani, and my uncle, the Honorable Sangabatwale Kelma, for supporting this very timely motion. Right Honorable Speaker, I think I want to correct the record from the Honorable Kim. The motion we moved here was basically for the Pamoja bid 2027, the African Cup of Nations. This is CHAN. And may I educate and give knowledge that CHAN is basically a tournament played by players who only play in the local league without professional players. And this is the Africa national champions. And I want also the mover to appreciate, to collect, is CHAN 2024. Only that it was played in 2025, but it's CHAN 2024. Just because they allowed the host nations, this was a precursor for us to test if we shall manage to host the African Cup of Nations in 2027, which we call the Pamoja bid. So the CHAN is also Pamoja. And the delay was because the partner states requested for time to prepare the stadiums. Otherwise, we would have lost an opportunity if we hosted that tournament at that time, because the infrastructure development was not ready. And Right Honorable Speaker, I want to report to you as a person that was a center specifically at home, that this is the first tournament that received a lot of supporters in all across the partner states compared to the others that have been played. And a total of 90 goals were scored, Right Honorable Speaker, compared to 380 of the UEFA Champions League, where they had played 380 games. This was only in a space of 40 games, Right Honorable Speaker. Right Honorable Speaker, I also want to encourage and ask the mover if they can allow to appreciate His Excellency President Yoweri Kaguta Museveni for the motivation of players, His Excellency William Samoei Ruto, that came up to motivate supporters, and His Excellency Mama Samia Suluhu that also came. And they were giving personal motivation outside the set parameters. For instance, every win in Uganda was $1 billion, $1.2 billion. In Kenya, there was an amount, I think $22 million. I mean, $2 million per match. In Tanzania, is the same. And as well, President Paul Kagame that has come up personally to do motivation. I think, Right Honorable Speaker, once we enumerate this and appreciate that they come up out of the many things to do this from motivation, Right Honorable Speaker, this helped. For the Assembly, Right Honorable Speaker, and for you, I think it is not only enough for us to do the resolution. We can do certificates to appreciate the specific federations signed by the Speaker and maybe the SG of the community to specific federations, to Kenya Football Federation, to TFF, to FUFA, and the federation that hosts the cycling in Rwanda, specifically, Right Honorable Speaker, and the respective ministries, in appreciation that the thing they did is promoting our Right Honorable Speaker. That a certificate is the only thing we can give, but that's an appreciation that we appreciate whatever contribution they do. And I want to, Right Honorable Speaker, this hosting successfully this tournament, we passed a test that we can actually host the African Cup of Nations, which is much bigger in the coming 2027, and also the development of the stadium, and maybe to encourage that our partner states and governments should improve on the areas where we had issues in terms of facilities and making sure that we deal with the small things at home. But finally, Honorable Speaker, the CAF president has commended the partner states for having successfully hosted this game that brought us together and gave us a rebirth that this region actually has potential of showcasing whatever we can do. Right Honorable Speaker, with those few remarks, I heartily beg to second this motion.
Thank you. Thank you, Honorable Dr. Black. Now we have closed. Let's give the floor to procedure. What? Motion.
Procedure.
You have the floor.
Thank you, Mr. Speaker. Mr. Speaker, this motion has been having been debated. There are some proposed amendments. And some amendments have been captured. We've shared with them with the mover, and she's acknowledging that she has them. But there are some which have not been captured. We can also send them to the mover so that they are accommodated. Speak of one, maybe you see we are talking about sports diplomacy, that we would like to have the council to ensure that sports diplomacy is given a priority in the community, so that the objectives of we have sensitization of the EAC citizens. We foster both informal and informal relations between the regional players, like time we go for games and others that may come. And in this, we foster peace, and together we achieve the objectives of the integration. And finally, the one for commending the members of the summit that my brother Honorable Saranda has just raised, and is also recommending to us here. And maybe we should think about issuing a certificate of appreciation to the members of summit, and also to those football associations and the one which organized the issue of cycling. So if we can have them in our recommendation in the final resolution, and then we may work on them forward to see whether we can have a joint certificate between the Speaker and the SG signed and sent to those capitals. Thank you, Mr. Speaker.
Thank you, Honorable Dr. Makami. Now we don't know if the Minister, Honorable Minister, do you have a remark? If you don't have, we proceed.
Mine is brief. It is very gratifying to receive, for the states to receive commendation of the magnitude of the assembly. And I'm grateful that you have considered this, showing that the House has indeed understood the impact of the games when they are taking place. Even at my own level, usually I'm a bit older now, but I was able to be young that day and to see some of the games. And therefore, I joined East Africa on the basis of that, of those games. I'm sure, therefore, if we continue with that spirit, and in fact that the recommendation from you now will stiffen that spirit at various levels of government, and hopefully, even in the future, we should have better and greater arrangements to ensure the realization of these aims. Thank you. I'm happy to associate myself with the motion.
Thank you, Honorable Minister, for your contribution. So, honorable members, before I give the floor to the mover, it's just to remind you that if you have amendment, you should put them in writing. And the amendment must also be accepted by the mover. With this, I give the floor to Honorable Falada to reply.
Speaker, thank you for giving me the floor. I have noted some of the additional resolutions from Honorable Makame, and some of the additional resolutions from Honorable Kim Guy and Honorable Siranda. First of all, I want to thank the seconder of the motion, Honorable Clement, and for contributing and commending on the activities that have been hosted by the partner states. Also, there was comment from Honorable Maina regarding us being the policymakers to mobilize the talents or develop a safe environment. Honorable Kadogo also talked about the demonstration of the community to the higher level. Honorable Kim talked about also infrastructure, which also I captured. Therefore, Honorable Speaker, I want to thank and appreciate the following members. Honorable Clement Seconda, Honorable Maina, Honorable Kadogo, Honorable Kim, Honorable Gideon, Honorable Siranda, Honorable Makame, who also gave me the additional resolution which I noted, and Honorable Minister, I thank you too. Thank you.
Thank you. Now, honorable members, I have to put the question that this assembly do resolve to commend EAC partner states for successfully hosting continental and international sports activity. Those in favor say aye. To the contrary, you say nay. The ayes have it. Honorable members, before I adjourn, we have been, every morning we have been gathering to that field. And today, we were a good number. But there are some members who have never been there. We wish that tomorrow, those that you have never seen, we wish to see them tomorrow morning. It's just 30 minutes. It's just walking around and around and doing some exercises with others, colleagues. It is a good time that we can spend together. So, honorable members, try to be there, all of you, all of us, tomorrow. And I will be there also, as I've been doing it. I'll be there tomorrow. I hope meeting all of you there. So, honorable members, with this, I adjourn the House tomorrow, Thursday, in the afternoon at 2:30 p.m. Thank you.